Okay, now that we've got the stones out of the bladder, we irrigated. I went back in with my, we prefer not to include the lining of the bladder with our suturing, but it's so thick, you can see how thick that bladder wall is, like 1/4 of an inch thick in this cat. So simple interrupted is the way to go, or simple continuous, but I'm going to go with simple interrupted here. Actually, I'm going to go with simple continuous. And the reason is, I feel that it's going to provide a better seal. The Cushing and Lambert pattern has been described, but when the bladder wall is this thick, you certainly don't want to do that. That's used with gastrotomy closures, because you don't want stomach contents coming out. You're using what's called an inverting pattern here. This is called an appositional pattern, what I'm doing in this case, where the edges come together flush, edge to edge. And I'm going to cut that end short, and I'm going to go back and make another bite and just do a little spiral, simple continuous pattern. These are partial thickness, just for the aspect of trying to avoid the lining of that bladder forming a nidus for another stone. Now, good grief, these are going to be dissolved in probably about 3 weeks. Our main strength is going to be gone at that point. Whereas polydioxanone suture, this is more of a monocryl type suture. Oligocaprone, it's monofilament. But polydioxanone may not go away for 6 months, and that's when you can get some suture reactions and some other problems. Try not to loop that suture. There's a pattern on cattle, large animal surgery, more common to do what's called a forward interlocking pattern, especially when closure of the skin. You're looping your continuous suture. I've almost never done that with these small animals that we do on anything. But you've got a muscularis layer to your urinary bladder. You've got a serosal layer or adventitia on the outside, and then you've got a submucosa, of course, between your mucosa and the muscularis, and then you have a mucosa, which is the lining of the bladder where the urine comes in contact with. You got to get enough bite, or your suture is going to break open, and you sure don't want that. I had one many years ago that was thicker than this, and it did break open. You know, the cat didn't die, but it's not something that you want to deal with. This is a female, thank goodness, because you get a male with stones like what I removed, sometimes those stones will lodge in the urethra, because the urethra of a male is, of course, longer than that of a female. There's more passage and more chance for there to be a blockage, and that is really hard to get a stone that is lodged in a cat's urethra out, especially when the edges are rough. So one disadvantage of a simple continuous pattern is if one breaks, the whole thing comes undone. But it speeds up your surgery too, decreases your anesthetic time. You just have to get a good bite each time. Make sure things are good and tight. Pull on that. That is all she wrote. All right, very good. The abdominal cavity. We're going to irrigate it first, a little bit more, flush it. And these stones we sure want over here. Remove all these sponges. We're going to flush with some saline. We're going to sew up the muscular layer, the abdominis rectus, the subcutaneous layer. Some people don't do that in cats, but I do. And I'm going to try to do an intradermal closure to close up that skin so the cat is going to have a harder time getting at the incision, at the stitches. All right, that's it.